Hey guys, Dr. Ennis in Boca Raton, Florida here at Ennis Plastic Surgery. Today we're going to talk about the deep plane facelift. What is a deep plane facelift and why is it different than other techniques? Today we're going to talk about the deep plane facelift. Why is it different and what's different about the deep plane facelift than the traditional SMAS or old skin only facelifts? So to understand it, you really have to go back and look at the history of facelifts. Go back 1970s, 80s, even early 1990s, the old facelifts were a skin-only facelift where the skin was pulled straight back. At the time, it was the best option, but the problem with it technically is the skin is very elastic and begins to stretch back out. So every 5 or 6 years, the skin would stretch out and the ladies would go back and pull it up again. So by the time they were 60 or 65, a lot of these ladies had 3 or 4 facelifts and they started getting stripes on their face this way. Very easy to avoid that over-pulled, overdone look when you simply understand that gravity doesn't work this way, so pulling this way was the wrong direction. So around 2005, plastic surgeons started getting smart and said, you know what, we need to be addressing the ligaments or the structural support in the face. So we started doing SMAS facelifts, SMAS, which is the ligament layer in the face. And what we did is we tightened up the structural support, or the SMAS, which is the ligament that all the muscles are attached to. We did this by lifting back here. It was a huge step forward in the facial techniques. It took away the pulled look. It took all the tension off the skin. It did a great job of fixing the jawline, but unfortunately did nothing for this heaviness here. So now the gold standard is a deep plane facelift where we go underneath the SMAS and now we lift the muscles from here. If we lift the muscles from here, it allows us to recreate this nice jawline, recreate the nice contour in the central part of the face without looking pulled. So you'll see here, even the deep nasolabial folds and marionette lines have been fixed. So that's a deep plane facelift, which is by far the best. Even if we're doing a mini facelift, we're still going to address those muscles and ligaments. We're still going to do the same step-by-step process. So you may hear the term mini deep plane facelift. The underlying issue is still the muscles. To fix it, what you need to do is a deep plane facelift. Even on a young patient, even on a mini facelift, you still want to address the muscles so that it looks nice and natural. So when we do a deep plane facelift here, even if it's a mini facelift, the step-by-step process is the same, and we're going to address the muscles. Whether it's somebody who's 30 or 80, the process is the same, the surgery is the same. We're just addressing different issues at different times in life. So that's the deep plane facelift. Don't let it be confused with the SMAS facelift, and certainly not the old skin-only facelift, which looks so pulled.